Thank you for convening this very important hearing about our nation's readiness for distributing and dispensing medical countermeasures. I'd also like to express my gratitude to those of you who've served on our behalf. We're very grateful for that, and thank you. As a representative of the 37th Congressional District, I understand the critical importance of developing effective nuclear, biological, and radiological and chemical countermeasures. The Port of Long Beach and other critical infrastructure is throughout my entire district, not to mention the large population that Los Angeles County faces, us being the largest county in the entire United States. We must ensure that the federal, state, and local efforts are coordinated to ensure a seamless and expeditious distribution and dispensing process to respond to bioterror, pandemic events or emergencies caused by a natural disaster. There have been major improvements to the nation's public health infrastructure over the last decade, especially since the anthrax attacks that we had and even faced here in Washington, D.C. Most importantly, however, our state and local health departments, who serve as the backbone of our distribution and dispensing efforts, have made great progress in planning and navigating through complex logistical challenges. However, we must ensure that the federal efforts support state and local health departments, who under law have the primary responsibility for the health of our citizens. Therefore, when we consider the federal efforts that should be taken, unfortunately, a decade of gains to our state and local public health departments are endangered based upon the budget cuts, the proposed budget cuts. According to a December 2010 study by the Trust for America's Health entitled Ready or Not, Protecting the Public's Health from Diseases, Disasters, and Bioterrorism, 33 states and Washington, D.C. have cut funding for public health since 2008. Also, since fiscal year 2005, federal support for public health preparedness has also been cut by 27%. Funds for public health allocated during the 2009 pandemic flu response and through the Recovery Act helped to provide some support, but did not address the need to build a sustainable capacity for a large-scale response. The erosion of state and local public health infrastructure and workforce leaves us at risk and not being adequately prepared to have the basic capabilities to meet time-sensitive goals of dispensing medical countermeasures. I look forward to hearing specific effects that you might feel would be impacting your area based upon the cuts that have been proposed, and we in Congress must assure you and provide the support you deserve to address these health challenges. Inadequate emergency health preparedness puts our nation at risk, and we must be resolved now prior to being tested by another large-scale emergency. In addition to funding issues, I'd like to hear about the lessons learned from the 2009 H1N1 response and what is being done to protect our at-most risk populations, especially children in schools and daycare centers. Again, I thank you for being here today, and I look forward to your testimony.
Thank you very much.